Welcome to the audiocast, Room Turnover, everyone's favorite subject. I'm Joe Tamara. I'm the General Manager of Accelero Health Partners. Last audiocast, we talked about the importance of starting the first case on time for joint replacement or for orthopedics. In this audiocast, we're going to discuss a second area of opportunity that really is near and dear to everyone's hearts, and that's turnover time. Joining me again today is Tim Sweeten. Tim runs our perioperative division here at Accelero Health Partners. So Tim, what is the definition of turnover time, and what do you see as far as the average, especially in orthopedic and total joint cases?
You know, Joe, you've just asked a very controversial question. The answer to turnover definition really depends on whom you ask. The surgeon will say it's from when he or she leaves the room until they get back to the same room. The staff will sometimes say that it's the time that the room is being cleaned. Now, our definition is patient out to next patient in, same room, same surgeon. The reason we use this very specific definition is that it captures the time that the room is not being utilized for patient care. Now, the other definitions are no less important, but beginning at patient out to next patient in works well as a starting point. Now, as for the average that you asked about, we maintain a database of total joints that is nearly 10,000 procedures strong, and in fact growing every month. We use this database to benchmark hospitals against in many different categories, such as first case on time start, patient in room to incision, actual procedure time, etc. Based on the latest data we have, the average room turnover time is 30 minutes.
So Tim, if you're seeing 30 minutes as the average, what are you seeing some of the best performers doing? What are their turnover times like?
The best performers are right at 20, 21 minutes. To get to that level, a lot of things have to happen.
Yeah, wow, that's a big difference. So even between the average of 30 to the benchmark of 20, that's 10 minutes per case. More importantly, I hear hospitals all the time that talk about 40, 50, 60-minute turnovers. So there obviously is a lot that impacts, an average to a best performer. So what are the primary problems that you see that impact turnover?
Yeah, while there's many factors, I would have to say that the lack of a defined process is the number one reason for time lost during a turnover. I have observed hundreds of room turnovers, and the one thing I know for sure that is an accurate predictor of short, successful turnovers is having a defined process where everyone knows exactly what they're supposed to do and when they're supposed to do it. I think of it similar to building a car, where sometimes the chassis is done first, and on the next car, the interior is done first, and different people build the car differently depending on which day and who's there and what they feel like doing. You have to think about room turnover as a manufacturing line where the process is absolutely set. This reduces variability and increases predictability. All of this, which in turn shortens room turnover.
So Tim, I love that we think about this as a manufacturing type focus, but we also know, and people say all the time to us, well, the operating room isn't a factory. This isn't manufacturing. Yeah. We've got the people factor in there. So, how do you apply what you've just described to how we change turnover in the OR?
Yeah, you bet. When we work with hospitals who want shorter turnovers, the process that I go through is this. First, I get everybody in the room who impacts turnover in a room. Then we talk through the current state of turning over a room, what has to happen, who's doing what, from patient out until next patient in. The next step is we actually record a live turnover process. When people are doing their job, sometimes it's hard for them to really understand how their activity fits into the whole. So we want to record that and let people watch that recording. So that's what we do. The group watches the video and discusses what went right and what did not go right, and oftentimes it's glaring. We then create a simple flow that describes each position from surgeon to anesthesia to housekeeping, what they have to be doing and what they need to be doing, and the reasonable time expectation to get that done. And we base that on real world situations, not your best case scenario. So we really want to understand what happens in the real world, and that way it becomes sustainable. Now next we take that flow and we turn that into a roadmap, which is then used to train all the staff, all the surgeons, all the people who affect turnover. And the last thing I'd say after that, we use the roadmap to truly measure the results. We measure against that. And as situations change, we change the roadmap to ensure that it's up to date, it's fresh, and it continues to be effective.
Tim, I like the thought of getting everyone in the room and videotaping that, the process, and having the group review that, and then creating the flow and that roadmap that you described. Give me an example, because I'm interested, when you bring the team together, how do they react? Give me an example on how this works.
Yeah, recently we've actually been doing some work in Europe, and a few months ago we were working with a large public hospital in Stockholm, Sweden. We got on site, we conducted our observations for an entire week of cases, and we saw that their room turnover average stood at 41 minutes. We believe that by using processes I outlined a few minutes ago, they had the potential to decrease that 41 minutes to at least 31 minutes, so decreasing it by 10 minutes. Now, initially, the staff and actually the administrators and a lot of other people there were quite skeptical, and they didn't mind saying that. I even heard someone say, "We can't work any faster. We're already worn out at the end of the day, and now you want us to work faster to decrease that turnover time." No, I had to really work to tell them that this is not about working faster. It truly is it's about being more coordinated. So to prove that point, got all the stakeholders together, surgeons, nurses, housekeeping, anesthesia. We got them all in the room, worked through the process I described a few minutes ago, which included videotaping it and creating a roadmap off of that. The staff was trained on that roadmaps. They were posted in all of the rooms. 2 months later, we went back over and we found an amazing transformation had taken place. Turnovers had decreased to 30 minutes. And when I was there, I even saw a 24-minute turnover, which was astonishing, and they could hardly believe it. Now, more amazingly, one of the nurses even commented to the group that we now complete the schedule early, and I don't feel as tired. And wow, I thought that was significant. So this recent example is by no means an anomaly or isolated to European hospitals. Following this process has yielded results in every hospital we have worked in the States as well.
Tim, that's a compelling case for showing this process works, right? You took 10 to 15 minutes of turnover time off in a 2-month period of time. I know hospitals that struggle for months trying to get that improvement. So my last question to you is, how do you sustain that? How do you make sure that process the turnover time stays low, and more importantly, that you even work to cut off more time?
Yeah, first of all, there has to be a focus on continuous improvement. There is no magic bullet for sustainability and engagement. But what I have seen work time and time again is to ensure that the roadmaps have gone into place and that people are all trained on those, and then the metrics measured against those roadmaps are posted and transparent. This vastly increases the chance that sustainability and engagement will persist.
Tim, this process you talked about also involves really a shift of culture in the OR. And that's what you do by looking at some of the processes that you talked to us about today. We're going to talk more about this cultural shift in one of our upcoming audiocasts. Turnover absolutely is one of the key areas that can impact efficiency in the OR. If you don't have sufficient time, or if your turnovers are too long, and you don't start your cases on time, now all of a sudden you don't have the ability to get those extra cases in. So those are two critical areas there. I want to reiterate, the process we use at Acceleros to work alongside the hospital, the team has to be involved in the process. That's part of that culture change that we talked about. So thanks everyone for attending this audiocast on room turnover. We know it truly is everyone's favorite subject. So if you have any questions with this or any of the other perioperative topics, please don't hesitate to reach out to your local Zimmer sales team member. They can get in touch with us here at Accelero and have a discussion with you on some of the issues you may be having in your OR. Also, you can get to us directly. Go to accelerohealth.com. Again, that's accelerohealth.com. There's a tab of Contact Us. Hit that link, and you can reach us directly, ask us questions. Thanks again for your time today.